Now we move on to the UK, where hundreds of thousands of workers have downed their tools across a range of sectors in strike disputes over pay. It is thought to be the biggest day of industrial action since the current wave of unrest began last year. Teachers in England, university lecturers, civil servants and London Underground drivers are all part of the strikes. Junior doctors today were said to be on the final day of a 72-hour strike affecting hospitals across England. Now joining us is our correspondent Laura Macon-Isherwood to get more information on this. Laura, what's the current situation and are the latest developments regarding the strike?
Yeah, well, we've seen, as you said, hundreds of thousands of public sector workers walking out of their jobs today, heading into central London, some of them, to march through the city and hold a rally very near to Parliament in Westminster. That's where the Finance Minister, Jeremy Hunt, was setting out his budget this year, trying to give the sort of promise to people that this wasn't going to be a terrible year economically, that growth was on the way. But this sort of flies in the face, doesn't it, of those claims being made by those public sector workers. They're asking for more pay, better working conditions, and that's something that the government has said simply cannot be done. They say there's not enough cash in the bank at the moment, in the Treasury, in order to offer them what they're asking for. And this action has spread across multiple sectors. As you said, we've had junior doctors on strike for 3 days. We've seen teachers walking out. We've got public sector workers, including civil servants, people that are actually working within the government to try to work impartially to make sure that government business can be done. And today, for the first time ever, people that work in HMRC, that is the department within government that deals with looking at taxes, trying to chase tax dodgers, they've walked out for the first time. Unions say that tens of thousands of those are actually having to not tens of thousands, around 40% of those people, get my figures right, are actually having to go to food banks. These are charity operations offering them food because they simply cannot afford to live. And that, those unions say, is unacceptable, and that is why they are out on strike. The government, though, doesn't appear to be that forthcoming in terms of negotiations with all sectors. They're pushing for health, but not necessarily others right now.
Now, you have said that there is resistance to meet the demands of the striking public sector, but is there any hope or any chance that this might change, considering that everyone is affected by the current cost of living?
Well, that's certainly the hope from unions, and that's why they're putting this action out onto the streets, trying to get their voices really heard and push the government to meet them for these negotiations. They say that that is the only way forward. They want some sort of movement from the government. We've heard from the Health Secretary, Steve Barclay. He said that he didn't want any more action at all. He said that some negotiations are taking place with nurses, for instance. They've been going on for days, but we've not heard the outcome of those yet. And we know that the nursing sectors have not ruled out any further action if they don't get what they want. I think the fear within the Conservative government is that if they move for one sector, then they might have to move for all. And particularly when it comes to transport, the likes of the train networks, they're really holding firm there, saying that this is all about trying to modernise, trying to move forward, trying to reduce costs and save redundancies overall. That, the train union says, is simply not the case. They say that their staff are being told something completely different and that they deserve better. But this is clearly an issue that's going to rumble on. And analysts say that as we move towards the next general election in 2024, these may well intensify these strikes, not just within the sectors that we've seen out on the streets today, but also wider within the public as well.
Now, considering that the government hasn't been forthcoming on meeting the strikers halfway, we know that strikes, particularly by health workers, can be rather disruptive. What's the extent of disruption across all public services, and how have the authorities responded?
Well, we've seen multiple strikes from health workers across the last few months. We've seen nurses out on the picket lines shouting, saying that they need more staff within their wards, saying that it's simply unsafe to continue in the ways that they are working right now, not enough people to simply deal with the number of patients that they have. This time round with junior doctors, there have been operations that aren't considered essential. They've been cancelled, appointments have been put on hold, and so government ministers argue that that's simply adding to the backlog that we're experiencing within the National Health Service in the UK, whereby there are more and more people having to wait longer and longer to see a health expert about various conditions. However, those on the front line, those that are on strike, say that this is essential, that this disruption for this 3-day period this time round is just a short, sharp shock essentially, and that actually it's far less of an impact than the wider crisis that the National Health Service is going through. The government will maintain that it's doing all it can to tackle the issues within the NHS, but clearly those that are working within it want even more support, saying that this is simply unsustainable.
Wow. Thank you so much. That was our correspondent joining us from London, Laura Macon-Isherwood, giving us an update on what could have been the biggest day of strikes by the public sector.